Let me ask you a question. Have you ever been sitting in a room where nothing is wrong, nothing is threatening you, nothing bad's happening, and yet your chest is tight, your stomach's churning, your brain will not stop spinning, and someone tells you, just relax, think positive? It makes you feel even worse because if it were that simple, you would have already fixed it. In the next few minutes, I'm going to show you 5 hidden reasons your anxiety will not go away, reasons that have nothing to do with your mindset, your willpower, or how strong you are. And by the end, you will know exactly which one applies to you and what to do about it starting tonight. You've tried the therapy, you've tried the breathing exercises, maybe you've tried the medication, maybe you've tried pushing through it, and yet here you are, still waking up with that pit in your stomach, still overthinking at 2 a.m. And the worst part is, you can't even explain why, because on paper, your life looks just fine. I'm Dr. Raj Langadi. I'm a double board certified psychiatrist and integrative mental health physician. I've treated thousands of patients with this exact pattern, and I can tell you it is one of the most common and most misunderstood problems in medicine today. Now, I'm going to walk you through the 5 real reasons your anxiety is stuck, reasons that most providers never even think to check. And once you understand which one's driving yours, the path forward becomes so much clearer. Point number 1. Your nervous system is stuck in survival mode. Your body has a built-in alarm system called the autonomic nervous system. When you are in danger, it turns on. When the danger passes, it is supposed to turn off. But here is what happens when you spend months or years under chronic stress, high responsibility, poor sleep, constant stimulation, and relentless pressure to perform. That alarm system stops turning off. It gets stuck in the on position. So even when you're sitting on your couch on a Saturday morning with nothing on your calendar, your body is still acting like a threat's nearby. Your heart is staying elevated. Your muscles stay tense. Your brain keeps scanning for problems. That is not anxiety as a mood. That is your nervous system trapped in a survival state. You are not anxious because you are weak. You are anxious because your body simply forgot how to feel safe. I see this constantly in high-performing women in their 30s, 40s, and 50s. They are running businesses, leading teams, managing families, carrying enormous loads with a smile. Externally, they look like they have it all figured out. Internally, their nervous system's been running on emergency power for so long, it doesn't know how to calm down. And because they're still functioning at such a high level, no one around them takes it seriously. They get told it is just stress, just part of being busy. That dismissal is part of what keeps them stuck. Think of your nervous system like a smoke detector. When it's working properly, it goes off when there's a fire. But when it has been triggered too many times, it starts going off when you are just making toast. The alarm is real. The sensation in your body is real, but the threat is not. Your system is just miscalibrated. And the fix is not to ignore the alarm or rip it off the ceiling. The fix is to recalibrate the system. But here's where it gets more complicated, because there is a second driver that most people never even consider and is one of the most overlooked causes of anxiety in women over 30. Point 2. Your hormones are hijacking your mood. If your anxiety suddenly got worse in your mid-30s or 40s, or if it seems to shift with your cycle, your energy, or your sleep in ways that feel completely unpredictable, there's a very good chance your hormones are involved. Estrogen, progesterone, and cortisol, they don't affect just your reproductive system. They directly influence neurotransmitters like serotonin, dopamine, GABA, other neurotransmitters that regulate your mood, sleep, and your sense of calm. When these hormones start to shift, which happens much earlier than most women realize, your brain chemistry shifts with them. But here's the problem. Most providers do not check for this. You go to your psychiatrist for anxiety and they look at your mood. You go to your OB-GYN and they look at your cycle. Nobody connects the two. So you end up on an antidepressant for a hormone problem. And you wonder why it only half works. Your anxiety might not be the psychiatric issue at all. It might be a hormonal one wearing a psychiatric mask. I've treated women who spent years cycling through SSRIs that never fully worked. When we finally looked at their full hormonal picture, we found progesterone had dropped, cortisol had chronically elevated, estrogen was in a range that was technically normal, but far from optimal. And once we addressed the hormonal piece alongside the mental health strategy, the anxiety finally started to lift. Not because the psychiatry was wrong, because it was incomplete. If your anxiety shifts noticeably across your menstrual cycle, if it appeared or worsened in your mid-30s or beyond, or if you're in perimenopause and feel like your emotional baseline has completely changed, these are signs that your hormones need to be part of the conversation. Not as a separate issue, as part of the same picture. Now, hormones are a huge piece, but there is a third factor that's even more commonly missed, and it is one that patients tell me about almost every single day, but rarely connect to their anxiety. If you're starting to realize that the reason your anxiety has not gone away is because nobody has looked at the full picture, this is what my channel is all about. I help you understand how your brain and body actually work together so you can stop guessing and start getting real answers. Hit subscribe so you do not miss the next video. Now, let me get into the third reason because this one's hiding in plain sight. Point three, your sleep is quietly destroying your resilience. You do not have an anxiety problem. You have a sleep problem that's showing up as anxiety. When you sleep poorly, even slightly, your amygdala, the part of your brain responsible for fear and threat detection, becomes significantly more reactive. At the same time, your prefrontal cortex, the part that provides rational perspective and emotional regulation, goes offline. So you wake up with less capacity to handle stress, less ability to manage your emotions, and a brain that's now hypersensitive to perceived threats. Do that for weeks, months, or years, and you create a cycle where poor sleep fuels anxiety, anxiety disrupts sleep, and the whole system spirals out of control. On top of that, poor sleep drives up cortisol, disrupts insulin sensitivity, weakens your immune system and response, and accelerates every other problem on this list. Sleep is not just a recovery tool, it's the foundation. And when it cracks, everything built on top of it starts to shake. I ask every single patient about their sleep, not just how many hours, but the quality. Are they waking up at 3 a.m.? Are they getting deep sleep or surface level rest? Are they wired but tired at night? Almost without exception, the patients who feel the most anxious are also the ones with the most disrupted sleep. And the frustrating part is many of them have already been told countless times their sleep is fine because they are getting 7 or 8 hours. But duration without quality is like putting water in your gas tank. The car does not run just because the tank is full. Quality over quantity does matter. Here is how to tell if sleep is the primary driver of your anxiety, not just a side effect. 1. Do you wake up feeling unrested even after a full night and your anxiety is noticeably worse on those mornings? Do you feel wired and alert at night, but completely drained and on edge during the day? Have you tried anxiety treatments that help somewhat, but never fully resolve the problem, and your sleep has never been directly addressed as part of the plan? If you said yes to 2 or more of those, sleep is not a secondary issue. It's likely one of the main engines running your anxiety, and fixing it needs to come before or alongside anything else you are doing. So, now you understand the nervous system, the hormonal piece, and the sleep connection. But there is a fourth driver that might be the most counterintuitive one of all, because it involves something your doctor already checked and told you was just fine. Point 4. Your metabolism is messing with your mind. This is the one that makes people stop and say, wait, that is connected? Insulin resistance, blood sugar instability, chronic low-grade inflammation. These don't just affect your weight or your energy, they directly affect your brain too. When your blood sugar spikes, crashes throughout the day, your brain experiences these crashes as mini emergencies. Your cortisol surges, your adrenaline kicks in, and you feel anxious, shaky, irritable, foggy, not because something scary happened, but because your metabolic health is totally unstable. On top of that, systemic inflammation from poor metabolic health crosses the blood-brain barrier, and it disrupts the same neurotransmitter pathways that regulate mood and calm. So you can be doing everything right emotionally, everything right psychologically, still feel anxious because your body's metabolic signaling is misfiring. I have worked with patients who were labeled as having treatment-resistant anxiety. They had tried multiple medications. They had done years of therapy. Nothing stuck. And when we finally looked at their metabolic health in detail, we found insulin resistance, inflammatory markers that were quietly elevated, and blood sugar patterns that were swinging wildly through the day. And once we addressed the metabolic dysfunction, the anxiety that had resisted everything else started to actually respond. So stop separating your mental health from your physical health. If you're anxious and you have also been gaining weight despite so much effort, if your energy crashes in the afternoon, if you have cravings you cannot control, or if you feel shaky or irritable between meals, your metabolism needs to be part of the anxiety conversation. Ask your provider to look beyond the standard panel. Ask about fasting insulin, not just fasting glucose. Ask about inflammatory markers like high sensitivity CRP, C-reactive protein. Ask about hemoglobin A1C, even if you're not diabetic. These are simple tests that can reveal whether your body is contributing to what your mind's experiencing. And if your provider is not willing to look, find one who will. Now, here's the final piece, and honestly, it might be the most important one, because everything I've told you so far points directly to it. Point 5, you have been getting care in pieces when you needed a plan. The reason nothing has fully worked is not because you have not tried hard enough, it's because nobody has ever looked at all of this together as one. Most people with persistent anxiety have seen a psychiatrist for mood, they've seen a therapist for mindset, a primary care doctor for labs, and maybe a wellness provider for supplements. Each one looked at their piece, Each one gave their recommendation, and nobody coordinated. Nobody asked how the sleep was affecting the hormones, how the hormones were affecting the metabolism, how the metabolism was affecting the neurotransmitters, and how all of it together was producing the anxiety that brought you through the door in the first place. This is not a failure of effort on your part. This is a failure of the entire system. You were treated in pieces, but you suffer as a whole person. And until someone looks at the whole person, you're gonna keep getting partial answers. Imagine trying to solve a jigsaw puzzle, but 5 different people each have a few pieces and none of them are in the same room. Each person looks at their pieces and says, I do not see the problem here. Well, everything looks fine from where I'm sitting. Meanwhile, you're standing there knowing the picture is incomplete, but nobody puts the whole thing on the table. That's what fragmented care does. And the moment someone finally puts all the pieces together in one place, that's the moment the picture starts to finally make sense. Tonight, I want you to do something simple but powerful. Grab a piece of paper or open the Notes app on your phone and map out your anxiety pattern using these 4 questions. 1. When is my anxiety worst? Is it the morning, afternoon, evening, middle of the night? Note the time. 2. What else is happening in my body at those times? Am I hungry? Am I tired? Am I wired? Crashing, bloated, restless? Write down the physical symptoms alongside the anxiety. How is my sleep honestly? Not just the number of hours, but how do I actually feel when I wake up? Rested or wrecked? And 4, who is currently involved in my care? And do any of them know what the others are doing? Do not try to diagnose yourself. Just map it, because when you start to see how your anxiety connects to your sleep, your energy, your cycle, and your body, you stop seeing it as a random, unexplainable feeling. You start seeing it as a signal, and signals can be traced, understood, and addressed at the root. Your anxiety is not proof that something's wrong with you as a person. It is proof something's going on in your body that has just not been fully understood yet. And the fact you are still searching for answers tells me you already know there is more to the story. Trust that feeling. It is not weakness. It is wisdom. If this video helped you understand what might really be driving your anxiety, I recommend watching my video on the 7 things I wish you and everyone else knew about your brains and bodies. It lays the foundation for everything I talked about today and will help you see the full picture of how your brain and body are connected. That video is on the screen right now. I'll see you there.